1995 is the 100th year since the beginning of chiropractic. There have been many accomplishments and considerable advances toward achieving recognition as a full-fledged healing art. Our colleges have multiplied and are approaching mature status as credible scientific educational institutions. Those of you who have studied with us the 4 videos have become or are becoming masters of your art and know that what we practice is unchanging truth. Sometimes it is good to recount in simple terms what has been accomplished. 1. We have proven that the most significant lesions in chiropractic and osteopathy are lesions of the intervertebral disc. We have developed exact tests for confirming and screening the spine for these lesions that are better than any X-ray, CAT scan, MRI, thermogram, or sonogram. We have found that there is a universal lack of protein utilization that corresponds to the fact that 80% of the population will have back pain or related pains. We have found and have muscle tests for all the other deficiencies that caused discal degeneration. We found that the Category 1 distortion is the basic human distortion with many variations. We found that the Category 1 is the most frequent cause of subluxations and that every vertebrae may be subluxated. We have shown that the use and understanding of the meridian or acupuncture circuits is necessary in chiropractic. We have demonstrated that interrogation of the body through muscle testing as taught by Goodhart and Versendahl is a superior, fast, economical, and reliable art and science that will ultimately have to be accepted. The Vickery method is the only postural correction that has a plan and is capable of keeping patients straight for years without the necessity of adjustment. We found 14 of the major causes of Category 1 distortion and their correction. We have found other mechanisms that cause distortion, viewing the patient laterally, and therefore we'll have to plan for one more video, which will present these mechanisms in our initial patient examination. We incorporated the work of Dr. Versendahl into our practice some years ago. We think his contribution is tremendous. Personally, I would not have been able to accept it but for the fact that I was fortunate to study with Dr. Voll, the founder of EAV, who taught us to find the myriads of infections that we all fall victim to. Using the amino acids enables us to cut Versendahl's 30 pills to 6 or none. The holism of our art, that is truly the only healing art which understands the relationship between posture and health and nutrition with both, may deserve a new name, such as Doctor of Health. I call the combination of my method with CRA and Voll the new chiropractic. The prophecy of Thomas Edison that the doctor of the future will give no medicine but will interest his patient in nutrition and care of the human frame has just been fulfilled. God bless you all.